Assalamu alaikum. Good evening, everyone. Welcome to the Real Story on ZMC Network. My name is, as always, Mr. Ali, your host for this evening. Apologies for coming on late. So today, as always, I'd like to start off my show by, first of all, commemorating the first anniversary of lockdown. It's been it's been a heart-wrenching year, and every level, whether it is through the loss of our loved ones, whether it is through the loss of our livelihoods, the impact on children, mental health, it has been enormous. Hopefully now, with the uptake of the vaccine, up to 29 million people in this country, with the majority of over 60 now being vaccinated, we can see the light at the end of the tunnel. And almost 2.5 million people have now been vaccinated with the second dose as well. And one good thing is that the West Midlands in particular is one of the highest regions in terms of uptake across the globe. However, the government has announced that in April we are expecting to have lower doses in terms of the supply chain, and we will obviously have no lower number of people being vaccinated. So that's just something to bear in mind. In terms of those numbers that we always share with you, 801 were the positive cases of COVID this week compared to 886 the week previous. And what that means is there were 70.2 per 100,000 population compared to the previous week of 77.6. In terms of the highest number of cases per ward, it starts off with Handsworth with 165, followed by Tyseley 130, Borsley Green 110, and then Borstal Heath and Bromford and Hodge Hill with 106. So where we are today, the topic is all about the vaccine uptake. We know that 29 million people have now been vaccinated in this country, but that is not the case across all demographics, all age, all BAME communities, and also whether you're from a poverty-stricken area or whether you're from a middle-class area. There's a huge variance, up to 35-40%. And today we are going to be talking about the vaccine uptake in BAME women, and in particular with regards to the Asian and the Pakistani women as well. Why is there a variance of as much as 40%? And someone that's going to help me to talk about that is Najma Hafeez, who has done enormous work around women's rights and generally championed issues, community issues. Welcome to the show, Najma Hafeez. Hope you're well. And brief, as you introduce yourself, please give a bit of a background as to who you are.
Indeed. First of all, I'm delighted to be here, and thank you for making this subject, which I think is so, so important. I won't go too much in my background. Suffice to say that, as you know, I've been in public service all my life since the age of 19, and I was on the council. I've represented the health trust. I've been chair of one of the largest health trusts in the country, etc., etc. But what I'd like to concentrate on today is, I feel it's really sad with my background in human rights and women's rights. You've just given the figures at the moment. And what's sad is if you break down the figures into minority communities, there is a clear difference between mainstream and ethnic minority people. The take-up of the vaccine is much lower. But if you look at the issues of women in the BAME communities, that figure is even lower. I think that's pretty tragic. Now, I'm here sitting with you. Hello, you've just outlined the tragic situation, but I sit here, I've had family members, unfortunately, who've passed away. I've had friends and family who have had and still have COVID. My older son, Umar, he's a medic, he's an A&E specialist. He comes home every day from work absolutely exasperated because what he sees is the suffering in the hospitals, the numbers of COVID patients. Previously, people thought it's only the elderly. What Umar is telling me is, Mom, there are so many young, normally healthy people in their 20s, absolutely suffering, can't breathe because they've got COVID. Okay.
Certainly in the
Now,
second wave, that's the case.
exactly. Now, the reason I mention all those is because please, please, I want to implore everyone who's listening or seeing this, I want to implore to them, please, please take the vaccine. There are lots of rumors in the communities. There are lots of rumors, even bizarre ones that I've heard, that the vaccine has got fetal content. Oh, for goodness sake,
Crazy.
that is not true. That is not true. The vaccine has been tested like all medication. It has cleared those tests, and that's why it is being given. It is safe. Now, as you know, there are two vaccines that people have, the first one and then the second one after a few weeks. Okay. Now, some people may suffer some side effects, but they're just like a headache or a temperature, very temporary. Compare that to somebody who's unable to breathe and stuck in hospital and dying. There is no comparison. So, what I would like to say is please, and the other thing is, you know, Ali, we live certainly in the West Midlands. We are a very high BME community, the majority from the Kashmiri community, and the our communities have been historically predominantly patriarchal. And so when you look at the reasons why people aren't taking the vaccine, I think the first reason is people don't understand the benefits. They haven't researched into it. They don't understand why and why it's so useful. The other reason, particularly in the BAME communities, is because maybe because it's patriarchal, you know, women especially will do what maybe the father, the husband, the brothers, the cousins, male cousins say. Now, if they don't have the information, then the women will obviously be affected negatively. So my message is very simple, very clear. As you know, I've worked in the health service half my public career. I have got family in the health service working today, dealing with COVID. I'm speaking from experience. I've had somebody very close to me, extremely close, die. So what I'm saying is, please, to everyone, if you care about yourself, if you care about your families and your friends, please be safe. Take the vaccine. Take it because it's good for you and it's good for everyone around you.
Thank you, Najma. Really good, passionate plea by Najma using her platform and her standing within the community to get that message out there. And I just want to explore some of the reasons. You mentioned that we are a patriarchal, historically certainly a patriarchal community, and sometimes the women do rely on their male members of the family to provide them with the education, with information, maybe even sort of take them to their medical appointments as well. And sometimes, you know, we even look to their fathers and their brothers and their husbands to take the vaccine before they take it. But you mentioned about the education piece, and that really resonated with me. That we should target, you know, a lot of the women. And do you think that the NHS and the government have sufficiently done so by getting that message out there in the native mother tongue? Because I know there's a a high number of women in this community that may not speak English as their first language. What are your thoughts about that, Najma?
Well, first of all, can I say that, you know, at present, we've got now the fourth and fifth generation born and brought up in this country. So I think predominantly the vast majority of our communities do speak and understand English. There are a few minorities of people who don't. So what you're saying is right. The health service has tried its best through its staffing to get the message across. I think we need to do more though. And that is why when you asked me, I jumped on this chance because I think all of us those of us who belong to the community and are in the community, who can communicate and have confidence with the community, I believe it is our right to inform and educate everyone out there not to be afraid. And please, if you want information, there's lots and lots of information telling everyone about the tests that have been done on this vaccine, the safety aspects, the safety of it, and the negative impact if you don't take the vaccine. So I will say the NHS is doing its best, but it's also up to us, Ali. It's up to us as members of the community who've got the ear of the community to say, please, please, please. In fact, you know what? Next week, I intend to use my contacts in the community through mosques and temples and community areas and all the people that I can access to actually spread this message and say, please, why do you want to risk death? Why do you want to risk your families and your friends when there is a vaccine available? Before there wasn't, but now there is. So there's no reason for people to die. That's what I would like people to understand.
Most definitely. And we know, Najma, the only way out of this pandemic is through vaccinating our public. And it has to be consistent throughout. We can't have pockets of communities not having been vaccinated. And in particular, we also know that we mentioned that there are a number of concerns that people are sort of concerned about, in particular with the stuff that's going on social media. People are worried that these two vaccines that have been licensed within the UK, they've been fast tracked within about 8 to 10 months. They've been licensed and manufactured. Normally, it takes about anything between 5 to 10 years. There's that concern. But it's what's more worrying for me, Najma, is when a lot of these ladies do go to their shops or speak to their other Sahelis and their friends. Their network is enormous, and they will get one bit of information which is out of context, completely false, without any evidence, and they will spread it to 10 other people, and that soon exponentially just reaches 10,000. And once it's in your mind, it's very hard to reverse that. So what's your message out there to those people that are propagating that fake message?
What I would say to anyone hearing messages like that is to please, please check your facts. Now, one of the myths is that some Muslim women, for religious purposes, and some Sikh and Hindu women, for religious purposes, don't take the vaccine because they believe that there may be alcohol in the vaccine. Can I say absolutely categorically, there is no alcohol in the vaccine. It has been tested, it is safe. The other thing that I want to reiterate is there's a myth that the vaccine will affect your chances of being pregnant. Can I say that is a total, utter fallacy? There is no evidence to suggest. In fact, initially, people were, the government, etc., were concerned that the vaccine should not be given to pregnant women. Now, after much research, they have said they are now giving it to pregnant women as well because it is not dangerous. It is protecting the woman and the child. So anyone going around saying, oh no, we're not going to give it to our daughters or our sisters because they may not be able to conceive, that is not true. So please get that out of your mind. Okay. The other reasons, sorry, you were going to come in, Italy? Did you want to say something?
Najma, please carry on. No, carry on.
And the other thing that I want to just point out is, if anybody's got any questions, please ask them. Ask your GP, ask anybody in the health service. Honestly, I will give you, because I'm so concerned about people not being protected, and people, by not having a vaccine, they're not protecting people in the community and their families. I'm so concerned about that. I will give through you, Ali, my own personal mobile number, and people can ring me. My number is 0797 065 2689, and we can give that out later as well. Anyone who's got any concerns, ring me. I will explain and lead you to the facts, so you don't have to worry. Don't be in the dark. And the other thing I want to say, Ali, is, Alhamdulillah, we are so blessed. We are in this country. We've got the vaccine which has been tested. It is free. We've got clinics now issuing the vaccines everywhere. Surgeries are issuing the vaccines everywhere. Precautions being taken. We've got all these, but you know what? If you go across the world, there are places, unfortunately, where this is not happening. People have not got the luxury of the health service. They have not got the luxury of having this vaccine available. They have not got the luxury of having access, i.e., being able to travel by transport to the clinics, etc. So please, why don't we thank our lucky stars, say shukr, alhamdulillah, thanks to God, we've got all these, so why are we risking our lives and our families' lives? So, Ali, my number is there, Najma Hafeez, my personal number. Anyone, feel free to ring me up if they have any concerns, and that is young men, young women, mothers, grandmothers, parents, anyone in the community. I'm happy to assist.
You can't ask for more than that. Najma Hafeez on this platform giving you her personal number and asking anyone to come and reach out to her. And, those questions that you have, those concerns that you have, please, she's not a medical professional, but she understands the nature of the vaccines and she has evidence to certainly counteract the misinformation that is circulating in the social media as well. And that's what I would say is, rather than relying on your family and friends for the evidence and the data, please ask the professionals. This is their day job. These are the experts. So let's go out to them as well. So really appreciate that. The other thing that I also wanted to sort of
Ali,
mention.
can I just add to that? Just to say, I'm not a medic myself, but I've worked in the health service for over 20 years. But I have lots of family who in the medical area. But I also, more importantly, I have access to professionals in the health service. So people don't have to take my word for it, okay? If you don't believe me, you don't have to take Najma Hafeez's word, but Najma Hafeez can give you access to professionals, to trained people, and to people who've researched into this area, and they can reassure you that the vaccine is safe, and it's imperative, please, that you take it to protect yourself and your families.
Well said. And the bit that you made around whether it is Muslim compliant, whether it is halal, you mentioned that it doesn't contain any alcohol whatsoever. The other concern is also around the content of porcine pork. Can you also shed some light and clear that misconception as well, please?
I can indeed. There is no evidence, absolutely no evidence to suggest there is pork content or alcohol content, or as some extreme people have been putting, and I've heard bizarre things like there are traces of the human fetus in the vaccine. I mean, that is such
Crazy.
rubbish.
Crazy.
Please, 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 no alcohol, no fetus, and everything is
No
protected.
pork.
Can you
No,
see?
no, well said. Absolutely.
I'm beginning to be frustrated, Ali, because I can't believe people are believing these things. So that's why
Yeah.
I'm saying, please, please check. Please check for the benefit of yourself and your families. You can check through me, you can check through other professionals, and please just check the facts, not hearsay, not what you hear, from other people who do not have the facts.
No, most definitely. And one of the initiatives that the government has really try to collaborate is using the NHS professionals with faith organisation and institutions. A number of mosques now, for example, the Al Abbas Common Mosque over in Clifton Road in Borsal Heath, Moseley Way, is now for about 2 months now are vaccinating their community, Muslim and non-Muslims, and as a result of that, that's really increased the uptake. Is that something that you would welcome?
100%, 100%. I welcome that. I promote that. I would promulgate that. I think it's very important to work within our communities, with our communities, for our communities. That is essential. Just another thing I want to mention, and that is, you know, we are alarmed at the disproportionate number of BAME community members who have been victims to this horrid coronavirus. Okay. Now, what I want to say is to everyone out there, let us understand many of our people are in communities which are not in the leafy suburbs, which have not got all the facilities and the luxuries that your leafy suburbs have, number one. Number two, many of there are disproportionately more Asian people suffering from things like diabetes, coronary heart disease, and cancer. And what we need to do, so anyone who's vulnerable or who's got a medical condition already is much more susceptible to catching this horrible disease. So that is why I'm begging our communities, please, please, please safeguard yourself, especially if you've got underlying conditions. Safeguard yourselves and take the vaccine. And also, there are lots of things you can do if you suffer from diabetes, for example. There are lots of people who've reversed their diabetes because they've changed their diet, they've changed their lifestyle, they've had more exercise. There are lots of people who do not suffer fatally from coronary heart disease because they have taken the steps to get themselves fitter and to get themselves healthier. So what I would say is there are lots of things we ourselves can do in order to be safe and for our families to be safe. So we are already in our communities, we are already vulnerable. And don't forget, the elderly population in general, throughout the whole population, is increasing. If you look at BAME communities, in our own communities, you know that the elderly population is also increasing. And so, you know, that beautiful generation, those beautiful people, our fathers and grandfathers who had the courage to leave our homelands and come to this country to give us a better standard and quality of life, they are vulnerable. So we need to protect them. We need to protect everyone who may have underlying conditions of health, and we need to protect ourselves.
Thank you, Najma. I'm just going to read out a couple of comments that are coming through, and then we'll give our final concluding remarks. Najma Hafeez, Assalamu alaikum, Ali Saab, and older lady ex-councillor Najma Hafeez. Najma was the first female councillor in Birmingham City Council. She is a pioneer and trendsetter. We salute Najma Hafeez, a very powerful woman who headed the powerful Social Services Committee in Birmingham City Council in the 80s. Muhtarim Shah, I had my vaccine today. And Najma, please do a summary in Midbury for our elderly community watching this show. We lost a lot of our elders and pioneers such as Uncle Nazir Wan, Uncle Aslam Wasan. May Allah forgive them and grant them paradise. Ameen. Great men, great personalities, and irreplaceable. Najma has made the ultimate sacrifice. Her son works for NHS. We salute her, Dr. Saab, son. Every blessing and reward for both Najma and her son. So very powerful speech by Najma, very emotional. So a lot of love out there, a lot of appreciation out there, Najma. So I'm going to leave it up to you whether you want to do it in Midbury or whether you want to do it in English. Please give a final concluding remark about encouraging women, but everyone to take their vaccine.
forgive me, I can't do Mirpuri, but I can do Urdu. मैं सिर्फ ये कहना चाहती हूँ कि मैं इतनी आपको इतनी सख्ती से कह रही कि प्लीज प्लीज मैं बेग कर रही हूँ आपको कि ये जो वैक्सीन है ना, ये बिल्कुल सही है हमारे लिए। ये वैक्सीन के पूरे टेस्ट हुए, ये सेफ है और ये बहुत ज़रूरी है हमें अपनी प्रोटेक्शन के लिए। अगर आप अपनी जान अजीज समझते हैं और अपनी फैमिलीज की जानें अजीज समझते हो, देन प्लीज प्लीज मेरा तो मैसेज यही है कि आप वैक्सीन लीजिए और अपने आप को प्रोटेक्ट करें। अगर आपके पास कोई सवाल है, आप पूछने चाहते, अगर कोई फिक्र है आपके दिमाग में कि जैसे ये मिथ्स है ना कि खुदा न खास्ता हमारी बच्चियां और जवान औरतें वो प्रेग्नेंट नहीं हो सकेंगी बिकॉज ऑफ द वैक्सीन, ये बिल्कुल गलत है, बिल्कुल फॉल्स है, इसको ना यकीन करो। प्रेग्नेंट वुमेन, अभी जो माँ बनने वाली हैं औरतें, उनको वैक्सीन मिल रहा है और वो बिल्कुल सेहतमंद ठीक है। और जो हमारी लड़के हैं जिनकी शादी नहीं हुई, उनका कोई डेंजर नहीं है फॉर नॉट कंसीविंग। सो प्लीज ये ना सोचो। अगर और भी जो फजूल बातें आपने सुनी होगी, फॉर एग्जांपल कि ये वैक्सीन इस्लाम के खिलाफ है, मुस्लिम्स नहीं ले सकते क्योंकि अल्कोहल और थोक इसमें होता, ये भी बिल्कुल गलत। आप ना जो रिसर्च हुई जो फैक्ट्स है ना, उसको यकीन करो प्लीज। आप मुझे यकीन करो, मैं झूठ नहीं बोलती हूँ और मैं कभी कभी कोई बात नहीं करूंगी जो किसी के लिए भी खतरनाक होगी। तो मैं इसलिए आपको कह रही, प्लीज प्लीज ये ना, अगर आपको फिक्र है मुझे खुद फोन कीजिए, मेरा नंबर मैंने दिया था, मैं फिर दोबारा दूंगी। मुझे मेरे अपने मोबाइल पे फोन कीजिए और मुझे जो मर्जी पूछना आप पूछे। तो अगर आपको फिक्र है कि चलो मैं, आप समझिए नजमा हफीज तो डॉक्टर नहीं है नजमा हफीज डॉक्टर नहीं है, लेकिन नजमा हफीज डॉक्टरों के साथ रहती है माशाल्लाह अपने घर में, नंबर 1। नंबर 2, नजमा हफीज के पास, बिकॉज नजमा हफीज हॉस्पिटल्स में और हेल्थ ट्रस्ट में काम किया मैंने, और सोशल सर्विसेज में आपने अभी मेंशन किया, मेरे पास बहुत ज्यादा लिंक्स और कॉन्टैक्ट्स है। अगर आपको चाहिए किसी और से बात करनी जिनको ज्यादा मालूमात होगी, प्लीज मेरे से ये भी ले सकते हैं, ठीक है। बस मैं और क्या कह सकती हूँ आपको, मैं सिर्फ कहूंगी कि प्लीज प्लीज अपना ख्याल रखो, हिफाजत करो, अपनी फैमिली की हिफाजत करो। ये जो वैक्सीन है, इससे डरो नहीं और इससे लो, क्योंकि इसको लेकर ना आप अपने आप को हिफाजत में रखेंगे और आपकी फैमिली और फ्रेंड्स को रखेंगे। और मेरा
आखिरी बात, एक वो
नंबर भी
अपना
लीजिए
मोबाइल नंबर।
जी, नंबर भी है, लिख लीजिए 0797 065 2689। मैं फिर बोलती हूँ 0797 065 2689। अगर आप नहीं लिख सके ना तो आई एम श्योर अली को आप फोन कीजिए तो पता ले लेना फिर, ठीक है। अगर कोई और सवाल
Thank
है
you very
मुझसे
much.
आप पूछ, थैंक यू।
That was the amazing Najma Hafeez giving you directly of your responsibility to get yourselves vaccinated in order for us to get out of lockdown as soon as possible. So, on behalf of the Real Story and ZMC Network, a huge thank you to Najma Hafeez for taking time out on a Thursday evening. And until next week, please look after yourselves and each other.